Hello, good morning, good evening, everybody. I am Vaidya Manvikar. I would like to introduce you and welcome you all to GCAR's Global Webinar Research Series. GCAR, Global Council for Ayurveda Research, is an international non-profit organization based off of USA. Our mission is to educate, encourage, and facilitate basic, clinical, and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer and we can place you in variety of projects based off of your skills and your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today. We are honored to welcome Vaidya Nachiket Wachasundar, a senior Ayurveda practitioner from Karad, Maharashtra, with over 3 decades of expertise in classical Ayurveda and Panchakarma therapies. He served as a medical director at Arogya Gram Ayurvedic Panchakarma Center and chief consultant at Jayavant Ayurved Medical College. He is MD in Kaya Chikitsa. Dr. Wachasundar has trained under legendary Vaidyas and has contributed significantly to clinical practice, research, and rural health through his Sukhayu Foundation. He is also a celebrated author, mentor, and international speaker on Ayurveda and Panchakarma. We are delighted to have him with us today. He will be shedding light on the very interesting topic, application of Ayurveda in the management of varicose veins. Let me hand it over to you, sir.
Hello, Namaste Vaidya. Good morning to all USA participants and good evening to those who have joined from India. I welcome all of you in this webinar on the varicose veins and its management with Ayurvedic science. It's my pleasure indeed to be with you this evening. I believe that GCAR USA is an appropriate platform through which I can share the valuable principles and thoughts of Ayurveda regarding varicose veins. I must thank the organizers for giving me such a wonderful opportunity to be with you all. It's worth talking about the varicose veins and sharing my ideas, views, and clinical findings regarding the same. This lecture also contains the essence of Ayurvedic text. I have also learned a lot from my various gurus that will be also reflected in this lecture. This lecture also reflects my experience of last 35 years of clinical practice in rural area in Pune and what I have learned from over 3.5 lakh patients up till now. I request you all that you please ignore the information regarding me when I was being introduced by Asauri. I am still a student of Ayurveda and I will remain a student forever. Om Namo Bhagavate Vasudevaya Dhanvantarye Amrita Kalasha Hastaya Sarvamaya Vinashanaya Trailokanathaya Om Shri Mahavishnave Namaha. My salute to Shri Bhagavan Dhanvantari, the god of Ayurveda. Man has found solutions for many diseases, including the surgical diseases and the infective diseases in recent past, but even controlled epidemics and endemics also. The challenge in front of the medical fraternity now is the diseases due to the change in the lifestyle, like diabetes, hypertension, thyroid, obesity, osteoarthritis, etc. So many diseases are due to the change in the lifestyle. So varicose veins is the disease which arises from improper lifestyle. So in today's webinar, we are going to discuss about varicose veins and its management through Ayurveda. This is very interesting topic, and I am pouring my 35 years of experience in this webinar. So friends, this session is going to be very interesting, informative, and practical. So you will definitely change your perspective regarding treatment of varicose veins in your daily practice. Please listen carefully and view the presentation up till the last slide. The pathophysiology of Shiragranthi explained in Ashtang Hridaya. We have got the slide of it. This description is very similar to that of the varicose veins today. The hetus are quite different. What are the hetus? After a prolonged walk, one dips his legs in the water, or after a strenuous exercise, one takes deep into the water and Vayu is vitiated, Vata is vitiated. It gives pressure, also dries the Rakta Dhatu, and Sirajal is formed. So here is no much pains or no spuran, no palpitation is observed in the earlier stages. They are called Siraj Granthi. Main dosha is Vata only. Celebrities suffering from varicose veins. Several celebrities have publicly shared their experiences regarding the varicose veins they have personally experienced. Britney Spears, Christine Davis from the Hollywood, Taapsee Pannu and Rajat Ravel from Bollywood, and Serena Williams from the world of tennis. Even celebrities are not immune from this issue. Even the Hollywood icon Angelina Jolie has suffered from varicose veins. Taapsee Pannu was operated for her varicose veins before joining her training of her film Rashmi Rocket. So celebrities and sports persons take due care of their health and their figure also, but still they suffer. So even if you are healthy otherwise and having great figure, you are not spared from varicose veins. The definition of varicose veins. Varicose veins are permanently dilated or distended, tortuous, palpable, superficial veins developing from the loss of valvular competence due to venous hypertension. So a vein becomes dilated, elongated, tortuous, beaded, and the vein is said to be varicose veins. They are blue, purple, greenish, or dark red color. Now about some glimpses about the varicose veins. Varicose veins are very common in India and even in US and abroad. So 10 million cases per year in India, they arise. So 60% of the people over 50 years of age are the victims of varicose veins. In US, the statistics says that every 1,000 has got 45 varicose veins cases. That means 1 in every 22 found as varicose vein patient. It's typically present more in females and the ratio is 1:2. Generally benign, harmless, as symptom-free, at least in the beginning. Both the legs can be involved, but left leg is more commonly involved due to the anatomical factors and the potential blood flow issues. Cosmetically, it is very important, even for the celebrities or else. Cosmetically, it is very important in many individuals. Otherwise, harmless, but when it becomes chronic and begin to show complications, then it gives rise to many problems. Causes of primary varicose veins. Long time standing or sitting professions, Here are some causes of primary varicose veins. Long time standing or sitting, obesity, sedentary and inactive lifestyle, Agnimandya due to dietary imbalance as per Ayurveda, pregnancy, constipation, old age, posture, vitamin K deficiency, vitamin D deficiency. There are so many reasons. Some professions are more prone due to their typical lifestyle. Teachers, surgeons, sports persons, nurses, shopkeepers, IT professionals, policemen are more prone. Pregnancy is, in the case of ladies, is a prime cause. Agnimandya. According to Ayurveda, this is the main cause of any disease. Rogaha, Sarvepi, Mandegno. Now the pathophysiology of varicose veins. Any risk factor or cause, what we call it as Hetu. When Hetu 7 is there, increased venous pressure in the Vata Vriddhi and then dilatation of the veins, that means Vyas and walls are stretched. Incompetent walls are formed, that means Dhatu Vaigunya, and reverse blood flow, that is Unmarga Gaman, and calf muscles fail to pump blood against the gravity. So venous distension. So maximum number of walls are present in the long saphenous vein. Long saphenous vein is the largest vein in the body. It has to pump the blood against gravity. So varicose veins are seen only in the superficial veins and not in the deep veins. Modern diagnostics. Color Doppler is a well-known tool to diagnose varicose veins nowadays, and other sophisticated tests like duplex USG, air plethysmography are carried out to assess the status of varicose veins. Now the stages of varicose veins. There are 6 to 7 stages of varicose veins. What we observe. Stage 1 is spider vein. That means reticular veins. Stage 2 is enlarged veins. Stage 3 is edema. Stage 4 is skin changes. Stage 5 is venous ulcer that heals. And stage 6 is non-healing ulcer. So these are the stages what we observe in our clinical practice. Types of varicose veins. There are basically 2 types of varicose veins. Primary varicose veins, the common site is the lower extremities as said earlier. That means superficial venous system of lower limbs. We have seen a typical patient in our clinic, 45 years of male. The reason behind his varicose veins was his previous surgery after a fracture of his fibula in the right leg. So an artificial rod was introduced in his right leg. Over the years, he developed varicose veins due to the changed anatomy after surgery. Now the common sites of secondary varicose veins. Common sites are esophageal varices, then hemorrhoids, that means piles, hemorrhoidal vein in the rectum, varicocele in the spermatic vein, vulva, and they can be seen on even face also. So these are some common sites of secondary varicose veins. Now complications of varicose veins. There are many, but in some cases, most of the time, varicose veins don't create any serious complications. But in some cases, 2 to 5% or 10% they say, they do become troublesome. So one should not ignore varicose veins in the beginning. In the beginning, if we take due precautions and change our lifestyle, then we will be able to prevent the complications, definitely. So Ayurveda has got multiple tools by which we can treat the varicose vein patient successfully. Conventional management of varicose veins. When we were students of first year BMS, our anatomy teacher introduced varicose veins as a disease in the context of the applied anatomy of the lower extremities to us. He said, you have become doctor of varicose veins in the first year, because the only available treatment then was leg elevation and the pressure stocking. So he said, you have become doctor of this single disease. So you are doctor of one. So laughingly he said, the diagnosis is very simple. You can see by your naked eyes. And the treatment is also simple. That is no treatment at all. So over the past decades, many treatments have been introduced in the modern medicine, but still their results are doubtful. So scope of Ayurvedic intervention. Conventional treatments are of temporary use as the basic cause of the disease lies in unhealthy lifestyle. So recurrence is obvious. So number of doctors and specialists and the dedicated centers for varicose veins are limited in India. The chemicals used for sclerotherapy like treatment, they are hazardous. The expensive treatments, as you must have been heard, that cosmetic type of treatment, they charge more money, and only celebrities can afford. People don't accept compression stockings for a long time because they feel uneasy. But the Ayurvedic treatments, what we suggest, are safe, convenient, patient friendly, effective, and they are having practically no side effects. And recurrence is also not there after the Ayurvedic treatment. So a punarabhav chikitsa is possible in case of Ayurvedic treatment. And cost-wise also, our treatments are affordable. So I thought there will be a solution for varicose veins in Ayurveda, and we could find out the solution, which I am going to share with you. So there is definitely a good scope of Ayurvedic practitioners where varicose veins are concerned. Trivid Pariksha. The Darshan Pariksha, Sparshan Pariksha, and Prashna Pariksha. These are the Trivid Parikshas told by Ayurveda. The Padashok, Vaivarnya, Vagdushti, and Vurana. Then Sparshan, Manivat appearance, Manivat or Sparsha Sahatva may feel, or Shita Sparsha may feel. So in Prashna Pariksha, to the Kandu Daha Spurana Jadya related questions should be asked by the physician, and Trivid Pariksha is carried out. Common signs in varicose veins as per Ayurveda with the differential diagnosis. In practice, if a patient of painful legs comes to a practitioner, he never pulls his pants of the patient and examine him with naked eyes. That means Darshan Pariksha. And directly advises the patient to go to undergo MRI or X-ray or other investigations. If the patient is obese and having sedentary profession, he is bound to develop varicose veins. But this diagnosis is often missed. The MRI reveals age-wise anatomical changes in the spine, and the patient is convinced for the spine surgery. Even after spine surgery, the complaint of the patient remains the same because the diagnosis is completely mixed. So when he comes to our clinic by merely Darshan Pariksha and a course of pain or the other symptoms and the history, we can diagnose it as varicose veins. So in each patient of leg pains, this is the practical hint given by me. So in each patient of leg pains, there should be carefully examined for the differential diagnosis of varicose vein, and it should be excluded. Varicose veins, Ayurvedic understanding. Doshas are Kapha and Vata. Dushas are Rakta, Mausa, Rasadhatu, and Sira. Kavaigunda is Sira. The main symptom told is Vayu Prakop Lakshan, and a Sakti, the site, is the Vata Dosha Sthan, and Vardhakya, that means Vaya, is Vata Prabalya. To treat Kupitvat, Kaf, and Raktadushti is our principle. Nothing else. Apathyakar Ahar. Ayurveda suggests us Pathyakar Ahar and Apathyakar Ahar. So Abhishandi Ahar, Kaphavardaka Ahar, having the gunas like Guru, Manda, Himas, Snigdha, Madhura Ras, and Lavand Ras, they should be avoided. This is a list in front of you. And Vata Parkopak Ahar should be also avoided, and Rakta Dushtikar Ahar should also be avoided. That means Tikshna, Ushna, Vidahi, Rakta Prakopak Ahar, tea, coffee, spices, and alcohol, they should be avoided. Apathyakar Vihar, that is very important. So long-term standing and sitting should be avoided. Lack of physical activity and exercise should be restricted, and improper sitting posture is also a hetu, so it should be avoided. Pathyakara ahar. Ayurveda Chikitsa is all about ahar. Here there is a big list in front of you, but I want to highlight 3-4 foodstuffs for your practical study. Suran, that is elephant's yam, is the drug of choice in varicose veins and also food of choice because it's a medicine also and it's a foodstuff also. Because in Arsha Chikitsa, Suran is having very good importance. Then Lasun, garlic, it is having a peculiar property by which it helps to transport proteins in the lower part of the body as per the new research. And moringa, that is shigru, is also useful. So suran, lasun, moringa, this should be included in your diet. And vitamin C rich food is also advisable. Vitamin C strengthens the blood vessels and the weakened walls. And amla is very important in the diet according to our experience. We always say our patients to have amla in their diet regularly. Now Vihar Chikitsa. Since the disease is of faulty Vihar, it should be Vihar Chikitsa, having importance to the Vihar Chikitsa. And Yogasanas, they are very important in the treatment of varicose veins. Yogasana help to cease the further deterioration of the veins. Stretching in asanas increase flexibility of muscles and veins. Muscle tone is increased, muscle mass is increased, and muscle strength is also increased. Neurological fatigue is reduced and strengthens the tendons. The asanas strengthen the tendons also. So increase blood circulation, which is against the gravity of calf region. Strengthening the calf muscle helps to pump the blood easily, reduces venous hypertension, reduces pressure on the walls, and clears the stagnant blood. Calf muscles are labeled as second heart. So strengthening the calf region helps heart to pump the blood properly. And Surya Namaskar for this is a great deal. So 12 to 25 Surya Namaskar daily is very important. Pranayama Dhyan strengthens your mind and increases the willpower and overall health. Aerobic exercise like walking, running, swimming, hill climbing, cycling improves blood flow and strengthens the muscles. Ankle is the main site where varicose veins are initiated in the beginning. So exercise of ankle is very important. Not merely walking or not merely yoga is important, but ankle exercise is of having importance. So ankle pumps, ankle rotations, seated marching, calf and heel raises, and small but very important exercises are very important. Since varicose veins is a disease related to improper vihar, one must go for regular and adequate exercise. If your exercise schedule continues for a long time or forever, then you can overcome the problem of varicose veins. Definitely. Varicose veins prevention and conservative management. Treatment of varicose veins is classified into two subjects, that is preventive and conservative management and interventional treatments. With proper preventive measures, symptoms can be controlled up to some extent. Further spread can be prevented. Elevating the legs often provided temporary symptomatic relief and regular exercise may help. So wearing of compression stockings with variable pressure gradients has been shown to modify the condition. As per Ayurveda, it's Western Chikitsa, Westernam Trasanam Seko. So Vata Chikitsa is there. So Western Chikitsa is also important. That means the stockings are important. So small lifestyle changes like intermittent walking, breaks while you are sitting for a long time is very important. So, prevention is better than cure. For the Nidan Parivarjan, you have to change your lifestyle and follow Dinacharya, Rutucharya, Vegadharan Nisheth, etc. Now, here the main theme of the presentation has been started. So various treatment approaches for varicose vein management. This is the subject of today's lecture and it starts now. So according to Ayurvedic principles, varicose veins can be treated by considering various approaches. According to Ayurveda, the name of the disease is not important, as vikara nama kushalo na jirihiyat kadachana nahi sarva vikaranam namatosti dhruvastitu. Secondly, the patients are having various etiologies and various stages, and considering individual case, the treatment may differ. There is no single protocol for any of the disease in Ayurveda. So we have developed various protocols for various approaches. Thus, we can treat varicose veins patients by different ways, like varicose veins as Sira Granthi, as we have stated earlier, varicose veins as Siragat Vat, varicose veins as Thaulya Chikitsa, varicose veins as Kaphavataj Kushtha, varicose veins as Vatarakta, varicose veins as Arsha, and varicose veins as Dushtabra. Ayurveda is a holistic science, but at the same time, Ayurveda treats each individual as a special case. Tailor-made treatment protocol is advised for each and every individual. Now we'll see how. Sira Granthi Chikitsa. If the patient is a beginner, a new patient, then use this classical Ayurvedic treatment suggested by Varbhat. And the Snehapan is the first drug of choice or first method of choice. Starting treatment is Abhyantar Snehapan with Sahachara Tel. Then Upanaha. Upanaha Svet is a local treatment for local pathophysiology with Vatanashak Dravyas like Atasi Upanaha. Even practically, Avagaha Svet or Nadi Svet is also advisable. Basti is a very important treatment because the pathology is Vata Bahulya. So, Apan Vayu Dushti is there in varicose veins. Then Malavashtambak is observed in many cases. And Vata Vruddhi or Vata Prakop is seen in many patients. So, Basti is advisable. If Basti Karma is not suited to an individual, then go for Murdu Virechan. But in some cases only. Main treatment is Basti. So Murdu Virechan with the help of Nishottar, Aragvat and Draksha is also advisable. Murdu Virechan should be after Sarvanga Snehan and Sarvanga Svedan. And Siravyat. Siravyat is the next treatment where the local blood shedding is carried out. So this is the basic Ayurvedic treatment for the varicose veins, considering is Shira Granthi. Now the second approach, varicose vein as Siragat Vat. Lakshanani are Manda Vedana, Shop, Shushkata, Spandan, Sira Kunchan, Sira Vruddhi, etc. If you diagnose the case as Siragat Vat, as described in Charak, Sushruta and even in Bhavaprakash, you can follow this classical treatment. Lakshanani we have already discussed. And the Chikitsa is Snehabhyanga, Upanaha, Mardan and Lep. All are local treatments. And Raktamokshan for Itvag Mouse Rakta Siragat Prakop. Varicose veins is nothing but Tvag Mouse Rakta Siragat Vat Prakop. So Raktamokshan is indicated in every patient. Varicose veins according to Sthaulya. Most of the patients of varicose veins we observe in our clinical practice that they are obese. And varicose vein is the outcome of Sthaulya. Here Sthaulya is the basic disease. So we have to treat the basic cause or the root cause of varicose veins. And in our experience, obesity when it is reduced, varicose veins symptoms are also reduced. Sometimes it is observed that only Sthaulya Chikitsa is enough for varicose veins. So if you cut down even 10% of your total body weight, varicose vein symptoms are considerably reduced. Sthaulya Chikitsa is consisting of Shodhan Chikitsa in the beginning, and then Ahar, Vihar, and some Ayurvedic medicines at the same time. Once we go for Ahar and we don't take medicine, we don't have Shodhan Chikitsa and then we start medicines. So it is not true. So periodically you should have Shodhan Chikitsa, then Ahar, Vihar should be maintained proper, and then Ayurvedic medicines should be administered on long-term basis, and then we will get results. And valuable tips for some stool patients. Mindful eating is very important. What you eat is not important. Mindful eating is important. Then 2 times diet. Now it is popular. Dr. Jagannath Dikshit's diet, 2 times diet. It also helps to many patients, and Ayurveda has also supported this concept. 32 बार चबाना, ये भी हो सकता है. That means you have to chew your food stuff 32 times at least. So it reduces your weight drastically. Intermittent fasting is also an idea. So by these ways, and Shodhan Chikitsa, Ahar, Vihar, and Ayurvedic medicines, and these all valuable tips, you can reduce the weight of the patients. And treatment of varicose veins should be coupled with Sthaulya Chikitsa. And Sthaulya Chikitsa, varicose veins Chikitsa, if consistently given, then we'll get proper results. Now varicose veins treated as Uttan Vatraktam. This is a different perspective, because this is a totally different idea and perspective. Considering the pathophysiology of varicose veins, we find out that it resembles the pathophysiology of varicose veins resembles with that of the pathophysiology of Vatarakta. Vatarakta is not merely gout as many of us compare it. Vatarakta is a well-known and thoroughly discussed separate entity in Ayurvedic text. It is characterized by systemic or local manifestations of blood, bone, joints, and the skin also. So it can be related to so many metabolic and neurovascular diseases and disorders like gout and other ischemic pathologies like varicose veins, DVT, SLE, rheumatoid arthritis, atherosclerosis, vasculitis, autoimmune diseases, etc., etc., etc. So the Vriddha Vayu, when makes its avaran to the path of Raktadhatu, Vatarakta is happened. In case of varicose veins, the same pathology is observed. So we can treat varicose veins as Uttan type of Vatarakta. It is involved in Tvag and Mas only. Mausa Dhatu and Tvag. So at the site of Asti and Sandhi, when Tvag Mausa Dushti is there, you can consider Vatarakta and treat the patients accordingly. Varicose veins can be compared with Uttan Vatarakta Lakshanani as stated in our treatises as Kandu, Daha, Ruk, that means Vedana, Ayam, Toda, Spuran, and Akunchan. Its treatment is Lep, Abhyanga, Parishek, Avgaha. That means the pathology is considered as local and suggested treatments are local too. Varicose veins in Vatarakta perspective. If the symptoms of your patients are Sirayams, Shul, then Spuran, Tod, Shot, Karshnya, Rauksha, Shavata, and described in the shloka written on this slide. The shloka is from Charak. Chakrapani Datta comments that Ayam is Vistaranam, that is expansion, and Sirayam is dilatation of veins, Dhamani Sankoch, that means contraction. And we will diagnose the entity as Vataj Vatarakta. And the Samanya Chikitsa of this particular entity will be Snehapan, Raktamokshan, Snehayukta Virechan, Jirna Ghrutapan. For Mrudu Shodhan, you can administer Dugdha and Gomutra or Dugdha and Erandatel. It has been administered as a Mrudu Shodhan. For Vataj Vatarakta, it is obvious that you select Basti Chikitsa. And for Basti Chikitsa also, you apply Dugdha and Gruta or the Shatapaki Balatel. Chikitsa Sutra for this Vataj Vatrakta is Raktamarga Nihantyashu Shaka Sandishu Maruta. So the main dravyas are Kokilaksh, Gokshur, Sahachar, and Dashmul. It is not stated in the slide, but Dashmul is also very important dravya. After this internal treatment, you can go ahead with the local treatment because local treatment is also important. Bahyopchar, that is Pindatel Pratisaran, Parishek Swet with the help of Dashamul Siddha Dugdha, Lep, and Upanapa. Varicose veins treatment as per Vatarakta. Again, if the Ayurvedic texts are thoroughly studied, we can come to the conclusion that in the Rakta Samsrushta Vayu, you can go for Vatarakta Chikitsa. If we consider Avruttavata concept, this entity comes under Raktavrutta Vayu. And the Acharyas have suggested us to treat Raktavrutta Vayu as Vatarakta, that means Kudva. So in case of varicose veins, that means Raktavrutta Vayu, you can consider the Vatarakta Chikitsa as described in the earlier slide. Some cases are having Pitta Dosha also. Pitta Dosha dominance is seen in some cases, and they are not responding to the usual treatment. So they should be considered as Rakta, Pitta, and Vayu, all three doshas, according to the Sushrut Samhita. And they should be treated with Rakta, Pitta, Anilahar Rasayan. These rasayanas are Amruta. Please note down. These rasayanas are Amruta, Shunthi, Gokshur, and Kokilaksh. These four rasayanas are used in the treatment of Vatarakta, and they can be also used in the treatment of varicose veins. Treatment of varicose veins, a novel approach. So up till now, I have described the varicose veins in terms of 4-5 aspects on the basis of Samhita. And this is my contribution. Treatment of varicose veins, a novel approach. Now a totally different approach to see at varicose veins. Here the disorder is Shiragranthi. And I will take you all to our anatomy physiology class of first year of BMS. And we were taught that the pathophysiology of Gudarsha, that is piles and varicose veins, is the same. Modern pathophysiology is excellent. It describes everything. But when the treatment part is considered, there is not any satisfactory treatment for piles and varicose veins also. On the contrary, Ayurveda has got satisfactory treatment for piles, that means Gudarsha. So why not we apply the principle of Chikitsa of Gudarsha to the treatment of varicose veins and apply a concept of modern medicine to Ayurveda, I thought once. And then we started giving this treatment to varicose vein patients. Because Ekam Shastram Adhiyano na Vidyat Shastra Nishchaya Tasmat Bahushruta Shastram Vijaniya Chikitsa. If modern medicine people, they are extracting Ayurvedic principles and Ayurvedic drugs, why not we also extract, or we are not take from them? So here we apply treatment of Vatakapaj Arsha or Shushkarsha to stage 1 to 4 of varicose veins. That means Kapavataj Arsha treatment should be given to 1 to 4 stage, and for varicose veins stage 5 and onwards, we can treat as Raktakarsha or the Sravi Arsha. In our last 35 years of practice, we treat varicose veins patients on the basis of Arsha Chikitsa, and hundreds of patients have been treated so far, and a lot of cases are responding very well to this therapy based on this concept. So we say Shira Granthi Nam Arshavat Upacharayet. This reference is not from any Samhita, as I stated earlier. This is the outcome of the principles of Arsha Chikitsa applied to the Chikitsa of Shira Granthi. So Arsha Chikitsa in classical Ayurvedic text, there are two types of Arshas, Kapavataja Arsha and Rakta Arsha. Arsha Chikitsa in classical Ayurvedic Samhita is very well explained, and it also gives very good results in our clinical practice. First, we consider Kaphavatash Arsha Chikitsa. In Kaphavatash Arsha Chikitsa, Sneha Pratisaran, Upanaha Sved, Drava Sved, Dhupan, and some dravyas and Sthanik Raktamokshan, Kalpas, Basti, and lot many kalpas have been described in the treatises. So main dravyas useful in Kaphavatash Arsha are Chitrak, Suran, Ballatak, Brahmi, and Trikatu. Chitrak is Kaphavatashama, Dipan, Pachan, Shothagna, Lekhan, Rasayan. Chitrak plus Gomutra is the best yoga in Arsha. Suran used in Kaphavatash Arsha. It is an Ahariya Dravya, that is foodstuff, we have stated earlier. And Ballatak, the best in Kaphavatash Arsha. Kaphavatashama, Chedak, and no Vibandha is there, or no Kaphaj Vyadhi is there, which is not curable by Bhallataka. That means it is the greatest medicine for any Kapha Vat or Kapha Vyadhi. So it should be used as Tila Guda Bhallatak or Bhallatak Haritaki or Bhallatak Parpati form. Brahmi. Brahmi is Kapha Doshahar, acts on Sirasthita Vibandha, improves blood circulation, and it is having Saraguna, Vata, Kapha, Am, Stove, all they are nullified with the help of Brahmi. In addition, it is Varna Prasadan, Vedana Sthapan, Shothagna also. It is having two main ingredients, two main active principles, bacoside A, bacoside B. Both are very important, and with the help of Brahmi also, you can treat varicose veins in the form of Kaphavatash Arsha. Next thing is importance of Agni in the treatment of Arsha. Of course, Ayurveda suggests Agni Chikitsa in every Vyadhi, but they have emphasized specially in Arsha, Atisar and Grahani. Arshotisaro Grahani Vikaraha Prayena Chanyunya Nidana Bhuta Sanne Nale Santi Na Santi Dipte Rakshet Tatasteshu Visheshato Agni. So in Arsha, Atisara and Grahani, they are the etiological factors of each other, and Agni Rakshan is the treatment of choice in all the three entities. In Arsha Chikitsa, there is a different approach also. Which is this different approach? Vyatyasa Chikitsa. Vyatyas Chikitsa is the alternate Paraspar Viruddha Chikitsa. Vyatyasat Madhuramlani Shitoshnani cha Yojayet. Charak says, if a disease is not curable with a regular course of treatment, go for Vyatyas treatment. Madhur Amla, Amla Madhura, Shita Ushna, Ushna Shita. Ahar, Vihar and Chikitsa in the form of this Madhura Amla, Amla Madhura, Shita Ushna, Ushna. So this is called Vyatyas Chikitsa, alternate treatment. So now Raktarsha Chikitsa. We have seen now Kaphavatash Arsha Chikitsa. Now Raktarsha Chikitsa as per the classical Ayurvedic text. If bleeding is there and Vata and Kapha are the co-doshas, for Vata use Snigdha Sheet and for Kapha use Ruksha Sheet. Ruksha Sheet Dravyas, Ahar and Vihar. For Durval Rugna, go for Langan, and for Sashakta Rugnas, go for Shodhan. Use of Param Tikta Dravyas for stopping the bleeding. Agni Sandipanaarthancha, Rakta Sangrahanayacha, Doshanam Pachanarthancha, Param Tikta Rupachari. So for to prevent the blood loss or to stop the blood loss, you have to use Param Tikta Aushan. And drug of choice is Kutaj. When there is bleeding from your varicose ulcer, then you go for Kutaj. And other drugs are Chandan, Yashtimadhu, and Ushir, which you know that Sheet and Stambhak Dravyas. Shushkeshu Bhallatakam Agryam. That means Bhallatak is the best medicine, best choice of medicine in Kaphavatash Arsha, Shushkarsha. and Bhaishajyam ardreshu to Vatsaktva. Means Kutach is the drug of choice in Raktarsha. Now, a novel treatment is very simple to apply. Even the US doctors or US practitioners can also suggest this treatment to their patients. Importance of Takra in the management of Arsha. So for Vata Kavach Arsha, Takra is the best remedy. It is not merely a foodstuff. It's a remedy for any Kapha Vataj disease and especially Vata Kavach Arsha. Either Takra should be used with Ruksha or Snigdha drugs. It is advised to keep the patient only on buttermilk. This diet should be continued for 7 days, 10 days, 15 days, 13 days. It is called Takrabhyas, indicated for Mandagni Janyavyadhi, mainly Arsha. So many recipes of Takra have been described. For varicose veins patients, Takrabhyas is a nice treatment. It increases Agni, cleanses the Srotasas, and hence transports Annarasa to all the Dhatus. And it reduces weight also. The piles, Arshankurs treated with Takra don't reappear. Even if you apply Takra in your lawn, your unwanted lawn will be disappeared. So Atyarthamanda Kayagne Ast Karkarme Vavcharet and Vatashleshwar Shasa Takrat Param Nastiha Beshajam. Vatashleshwar Shasam Takrat Param Nastiha Beshajam. So the best remedy is Takra, but it should be prepared at home. No company Takra or buttermilk should be applied. You advise the patient, please prepare it itself in your kitchen. Varicose veins as Kapha Vataj Kushta. If patient comes to you in the varicose eczema condition, varicose eczema stage, this patient has come in our OPD as a varicose eczema condition. And then you must think of treating him as Kapha Vataj Kushta. The signs and symptoms of Kapha Vataj Kushta resemble with that of the varicose eczema. So, Snehapan, Bahya Snehan, Virechan, Raktamokshan is the prime treatment for this. And in varicose eczema, we have to consider Shira Granthi also, Raktadushti also, and Twachadushti also. And accordingly, we have to treat it. As blood purification, Haridra, Triphala, Nimba, Vidanga, Khadir, Manjishtha, Bakuchi are helpful. Along with the varicose veins treatment, you have to treat the patient as Vatakapach Kushta also. Varicose veins, Pranavastha Chikitsa, management of varicose ulcer. If patient comes to you in the varicose ulcer condition, then you should treat it as a Vran. The varicose ulcer are likely to be found in elderly patients and very, very chronic patients. They are seen commonly on the medial malleolus. Severe wall damage is possible. Venous stasis is present over there, and such venous stasis favors local anoxia and local edema. This leads to the non-healing ulcer and forming Jeerna Vrana. And Jeerna Vrana turns into Dushta Vrana. So the results of varicose ulcer with Ayurvedic treatment are definitely encouraging. For that, lepas are also advised. Tila Madhugrut, Tila Spatika, Nimba Sendo, Sendo plus Tail. These lepas are very useful. And the importance of Terminalia Arjuna, that means Arjun, is very important. It is Kapha Pitta Shamak, useful in the treatment of Vrana, indicated in Raktarsha also, Raktadosha Nashak also, and it works on the heart and blood pressure also. So, Arjun is the drug of choice in varicose ulcers. So, Arjun can be used internally as well as externally as a powder in the powder form lep. So, two other dravyas are also important. One is Nag Keshar and another one is Kutach. They are also important in the Vrinavastha. Jaloka Raktamokshan is also the treatment of choice in Dushtamran. In the bleeding piles condition, we use the same medicines. Kutach, then Lakesha, then Suran, and then Arjun. So varicose ulcer, Bahya Chikitsa, like Vrana Dhavan and Vrana Dhupan. I suggest that here in our OPD, we have asked the patient to come daily over here, and Vrana Dhavan and Dhupan is done every day. Don't advise patient to do it at home because it is not properly done. This is my practical tip. Dhawan. Vrana Dhavan is a regular Vrana Dhavan is recommended. It cleanses the wound, prevents from further damage and recurrent infections. Quath of Panchavalkala, Triphala, Daruharidra, and Nimb. It is very important. This is the unique treatment of Ayurveda. Dravyas used are mainly Rakshogra Dravyas. They prevent saprophytic and gram-negative infections. The medicated fumes are used to apply on Vrana. Rakshogra Dravyas are used for Dhupan Chikitsa. Raktamokshan in varicose veins. Raktamokshan is an important chikitsa in varicose veins, as we all know. When we shed vitiated blood clots from the vein, the walls become free, tension free, and if the lesions are painful, the pains are instantly reduced. In beginner patient, the vessels girth is also reduced. The skin lesions are also relieved. The blood circulation through veins is improved, and strotosas become clear, and the sthanic and sarvadaik raktadushti is also reduced. So Raktamokshan is a drug of choice or the method of choice in varicose vein treatments. If raktadushti is there and it is not responding to any other measures, Shitoshna, Snigdha, Ruksha, Kriya, Adi, then they should be successfully treated with only Raktamokshan. So Raktamokshan is the choice of treatment of choice. For Tvagaroga, Granthi, Shof, Rakta Pradushta Vyadhi, Raktamokshan is the best treatment. Jaloka Raktamokshan of varicose veins. For varicose veins patients, Jaloka Raktamokshan is very useful. It is helpful in Vedana, Daha, Tod, Rag, and other skin anomalies also. In all the stages of varicose veins, it is indicated. In all the stages, it is indicated. It works in varicose veins, varicose eczema, and varicose ulcer also. Here is our patient who is having 3 jalokas at a time. As it is indicated in Granthi, it should be also prescribed in varicose veins. So it works well in Sira Granthi, that means varicose veins. We have got experience of applying leeches to such patients. In many patients, we apply such types of leeches. Jaloka Raktamokshan gives us very, very good results. This is Siravet Raktamokshan, the practical method of Sarvadaik Raktamokshan. It's an OPD procedure. Anybody can have in his OPD. You can shed blood by needle and syringe or scalp vein. It is indicated for Sarvadaik Raktadushti. By this method, we reap the benefit of the traditional Siravet, and we can measure the quantity of blood accurately. So blood clotting is also not an issue with this method, and we can control the amount of blood also. So Raktamokshan is believed to be the half of all the surgical treatment, Ardha Chikitsa by Sushu. So it's a great tool of Vaidyas. So do use Sira Vyad Raktamokshan in your day-to-day practice. Siravyad Raktamokshan is useful for Sarva Shariragat Avagadhatama doshas. So Siravyad Raktamokshan is important. Varicose veins Bahya Chikitsa. These are local applications. Some are oil, some are lepa, Rasan Kalkam with Multani Mitti, Haridra and Kumari, Tiltel Madhugruta, Tiltel Sandav, Shothar left plus Gomutra plus or lukewarm water, Dashang left, Gomutra, lukewarm water. So these are some external applications to cure varicose veins, and they do give good results. But here also, you ask the patient to come to your OPD and apply LEPAs or biotreatment in your place and your clinics. It is very important. Varicose veins, local treatments, Bhai Upchar. There are some another Upchara also. Kapavatas, for Kapavatas Dushti, apply Kasisari tel, Karanja tel, Nimba tel. It will increase the size of the varicose veins. As in the case of piles, Kasisari tel, Karanja tel, and Nimba tel should be applied on the varicose veins when they are big in size. And where Raktadrushti is there, Vrana is there, Jatyadi Gruta, Shatadauta Gruta, all these are sheath dravyas. See, Jatyadi Gruta, Shatadauta Gruta, Eladi oil, or Chandan Balalakshadi oil, or Durvadi Grut. These sheath dravyas should be used for Raktadrushti, Raktarsha, Vrana, that means varicose ulcers. So, now, in a nutshell, people will say that you have given us so many remedies that we should remember only one remedy and we will treat our patients. So this is only one remedy. The particular combination used for any kapha dosha, vata dosha, and even tridosha. For any sandarbhan janya vyadhi, you can use it, and varicose veins are on a large scale in most of the patients, they are Santarpajanya Vyadhi. So this Haritaki, Gomutra and Madhu. The indications are Arsha, Kushtha, Shrotha, Meha, Udara, Granthi, Sthaulya, Pandu, Urustamba, Kapha Medaj Vyadhi. So this is the best yoga for any Santarpajanya Vyadhi, and it is very important in varicose vein treatment also. You just remember only one yoga and you can practice. So mainly Arsha, Kushtha, Shotha, Meha, Udara, Granthi, Arbud, Sthaulya, Pandu, Urustamba, Kapha this yoga can be administered. This is a simple but very effective formulation. The beginner Vaidyas can start their treatment without much thought from this kalpa. And further, they can think more and they can have more treatments. Now, the commonly used kalpas in varicose veins. It's very simple. Those we use in Kaphavata Arsha can be used in Kaphavata varicose veins. That means in varicose veins also. So Arsha Kuthar, Kankayan Vati, Suran Vatak, Arogya Vardhani Ras, Kaishor Gugul, Sahacharadi Kashay, Aragvadadi Kashay, Abhayarishta, Punarnavadi Mandu, Navayaslo. These are all kalpas mentioned in Arsha Chikitsa. These are the commonly used kalpas in varicose veins. Because there is no satisfactory treatment of varicose veins in the conventional medicine. Leg elevation, stockings merely don't work practically. On the other side, Ayurvedic medicines are very effective in Arsha and varicose veins also. Try to use kalpas which are useful in Arsha. So they help by eliminating doshas, by increasing Agni, and by cleansing the Strotasans. So you will get very good results. Now, Rasayan and Apunurvo Chikitsa is the Balasthana of Ayurveda. Ayurveda has got a peculiar treatment, namely Rasayan Chikitsa. The Ayurvedic rejuvenation therapy focuses strengthening of the body and mind internally. So Rasayan Chikitsa is mainly a preventive treatment. So when varicose vein patient, they are okay with your treatment. But for Apunarva and for Rasayan Chikitsa, you can use some kalpas. That means they will not recur. So it is the therapeutic process of revitalizing and circulating vital elements in your body. Rasayan Chikitsa comprises a variety of herbs, therapies, diet, and lifestyle to boost the immune system, support good digestion and metabolism, and reduce stress levels. So it aims to delay the aging process and enhance a person's overall health, vigor, and vitality. So it also prevents recurrence of particular disease or disorder by cleansing and revitalizing the body tissues and the metabolism. So as Rasayan Chikitsa and Apunurbo Chikitsa in varicose veins, we use Rasayana in a Shirpak Vidhi, Haritaki, Shunti, Bhallatak, Kokilaksha, Amruta, and Punarnava. Amalki should not be used as a Kshirpak Vidhi. Rest of the dravyas you can use in the Kshirpak Vidhi. Then Takrabhyas, as stated earlier. I have earlier explained Takrabhyas, the buttermilk diet for 7, 10, 15, or 30 days regularly. The Takrabhyas is also Apunarvo Chikitsa and Rasayan Chikitsa. And regular adequate exercise. Regular and adequate exercise is Apunarvo Chikitsa, and it also gives Rasayan effect. And periodic Raktamoksha, Varamvar Raktamoksha, is very important for Rasayan and Apunarvo Chikitsa. One thing I have not mentioned on the slide, but it is a very important yoga. Please hear carefully. Gudashunthi yoga is also used as a Rasayan, Tridoshahar, Amapachan, Vibandhanashan, mainly Kaphavata Shaman, Shothagna, Vedana Sthapan, Anuloman, Arshogana, and Sprutoshodha. So friends, this is all about the varicose veins and Ayurveda in a very brief time. I hope you will all enjoy this session. All the respected dignitaries, office bearers of JICA, and all the participant Vaidyas, and my friends, my senior friends like Mukherjee, Rajan Patankarji, thank you very much for being with me here. I know you have spared your valuable time for this session. I must thank the organizers of this webinar for giving me the opportunity to share my views with you. Also, for arranging a valuable Tadvidya Sambhasha online, which will be helpful to every one of us for raising the curtain from the golden treasure of Ayurveda. Kudos to all the organizers and volunteers of JICA. And I am indebted to Vaidya Neha, my better half, and my son Vaidya Mihir and Vaidya Varda for helping me to prepare this presentation and also giving me their valuable inputs. So on this note, we will conclude this session. Namaste. Bye. Take care. Goodbye. Learn Ayurveda, live Ayurveda, and Jai Ayurveda.
Thank you so much. It was amazing. Thank you so much for such an informative presentation. So you explained the differential diagnosis, various approaches to understanding varicose veins really, really well. And especially the novel approach of treating varicose veins by using the principles of Arsha was very, very fascinating. It will be helpful for all our attendees and also the listeners about, in their own Ayurvedic practice. So thank you everyone for attending our webinar. And please let me know if you have any questions that you would like to ask now. And this recording will be available on our YouTube channel. So please watch and subscribe to our YouTube channel so that you can view earlier webinars also and definitely this presentation. Please like, comment, and share the videos. And once again, I invite you all to become a member and also fill out our volunteer form. You can now also subscribe to our IU update newsletter to stay tuned to our projects and events. So if you have any questions, please feel free. You can contact us at Ayurveda Research USA at gmail.com, or you can email me at asavari@mnayurveda.com. Yes, please.
As usual, he's a good orator, very studious. My friend Nachiket has explained it everything in a proper manner and in precise manner. So thank you, Nachiket, and thank you once again.
Thank you so much, Rajan.
Yeah, thank you, Patankar sir. It was amazing. Okay, so good night, everybody in India, and have a wonderful weekend, everyone who joined here from US. Bye and see you next month. Yep. Bye-bye.
Thank you. Goodbye.